Acalculous cholecystitis is not a super common pathology that you're going to scan unless you work in a high-risk population group. So I have personally never seen it, and I do pediatrics and have worked in hospitals before, but it's important to recognize what the symptoms are of it, who is it more at risk for it, and how to ultrasound it. So if we look at what acalculous means, whenever we put an A in front of something like atypical, it means not typical, right? So acalculous means no stone, and then we know that cholecystitis is an infection of the gallbladder. So we can break that definition down then to basically meaning that it is cholecystitis that presents without any stones. Now, there are certain people who are more likely to develop acalculous cholecystitis, and that is going to be pediatric patients. And we also see it quite commonly in patients who have had some sort of trauma. So that might be chemotoxicity, maybe postoperative patients, burns, or car accidents, some sort of trauma to the body. The other population that we see this in is in immunocompromised patients, so HIV, AIDS, liver or any transplant organs, or even chemotherapy patients. Now, the prognosis of acalculous cholecystitis is guarded, and that means that you really want to monitor these patients once they're diagnosed with that acalculous cholecystitis. There isn't a clear cause necessarily that is causing that cholecystitis or something that can be fixed right away. Like say it's a burn patient, they are not just all of a sudden not going to be a burn patient anymore. So you really need to monitor what the progression of the acalculous cholecystitis is, especially because that can develop into gangrenous cholecystitis. And if you recall from that lecture, that can be fatal once the gangrenous sets in and possible rupture of the gallbladder. So let's take a look at what acalculous cholecystitis looks like on ultrasound. As with any other cholecystitis, the main thing that we're really looking at is what does that wall look like? Does the wall appear thickened? And in acalculous cholecystitis, we definitely will have a wall that measures greater than 3 millimeters. Now, the other thing ultrasound-wise that we're going to see is that we are not going to see a stone anywhere within that gallbladder lumen. It also will most likely represent a positive Murphy sign if we were to scan over the gallbladder with some pressure, and that patient is going to have quite a bit of right upper quadrant pain. Some other causes for acalculous cholecystitis might be extrinsic compression of the cystic duct or common bile duct, and so there might be some lymph nodes in the portal hepatis area that you might be able to find, but that is also going to be pretty rare. So the main thing I want you to pull away from acalculous cholecystitis is that it is going to present just like cholecystitis, but there are not going to be any stones within the lumen, and that we're typically going to see acalculous cholecystitis affecting pediatric patients, trauma patients, and immunocompromised patients.